Hey, Dr. Mike here. Did you know that 1 in 5 Americans will experience a mental illness in a given year? Stick around to learn more about how nutrition can help.
You're listening to Live Foreverish, a show dedicated to helping you live just a little longer. Here's your hosts, Dr. Mike and Dr. Crystal Gossard.
All right, welcome to Live Foreverish. So, Dr. Crystal, Mental Illness Awareness Week was October 2nd through the 8th, right?
Right.
Extremely important to bring awareness to mental illness, because at the end of the day, there's a lot of people that, whether it's the stigma of it or maybe they just don't fully understand why they feel a certain way, they don't seek help.
Right. And it's a difficult conversation if you are on the outside looking in and you recognize that maybe something is wrong, and it's a tough conversation. So, this awareness, you always wonder about these awareness days and months and what they're all about. But you have to sometimes dedicate time here a week to get people talking about it, to remind people that there are a lot of people suffering.
And it's okay to talk about it.
Right.
It's okay to bring awareness to it.
Yes.
Right? So very important topic. Now, we say mental illness. What are we saying there? Because that's a big word. Right?
A huge umbrella. It refers to diseases that affect the brain and behavior. And this could be addictive behaviors, anxiety. They're the ones that we hear about more often than others, like ADHD or attention deficit, bipolar, but also eating disorders kind of falls in under that umbrella. Obsessive compulsive disorder, OCD, post-traumatic stress disorder. That's one that's getting some attention, especially as it relates to military individuals who maybe served in war and combat.
Aren't we also recognizing that PTSD it doesn't have to be some huge dramatic event either?
Right.
People have post-trauma from all kinds of things now we're recognizing.
Yes, you're hearing more and more now dealing or addressing and facing the childhood traumas that people have experienced. So yes, mental illness, it's a huge umbrella, but we do know 1 out of 8 individuals worldwide have a mental illness, whether they address it or not. It's there.
In the old day, it was all about upbringing, more about the nurturing side of things. Something happened in childhood, and that's, I think, still part of it. But we are now recognizing a more physical basis too.
Yes, it's not just mental.
Yeah.
Right. It involves the brain. It involves
there's physiology,
the body, as well as the environment
that
someone, grows up in.
Yeah. So I think that's a good way to think of it. It's a relationship between, brain, body, environment, and how they interact. And from there, we can develop some mental illnesses. I think for us, I'd like to focus this more on depression. Because we know out of all the different mental illnesses you just described, right, anxiety and depression are the big ones, right?
Right. The most common mental health problems in the U.S.
Yeah. I think I have something here. According to the National Alliance of Mental Illness, 18.1% of adults in the U.S. live with an anxiety disorder, and 6.9% struggle with depression.
Right. And you can see in groupings of studies, or a meta-analysis in particular, that pooled data from 24 studies reported the prevalence of depression among men and women aged 75 and older. So this is an older population. Found that 17% had depressive disorders, and about 7% had major depression.
Yeah, and depression. One of the reasons I want to focus on it, that's the mental illness that's probably linked to suicide the most. Right. I think if you were really to break it down, depression would be strongly linked to that. I know it's associated with something like 700,000, deaths a year.
Wow.
So I'd like to help out there. I think let's bring awareness to depression. Now, there's different types of depression, right?
Yes. Premenstrual depressive disorders, substance or medication-induced depressive disorders, depressive disorders due to a number of medical conditions. Now, the main type, though, is major depressive disorder or major depression.
Yeah. When you sit down with your doctor, there's certain things, certain criteria you have to meet to be called major depressive. If you're feeling down, feeling blue, go see your doctor. Go through some of those tests, right? Now, in many cases, you may not fulfill the criteria or all the criteria for major depression, and that's where the doctor will then talk to you about, well, what medications are you on? What's that? What else is going on in your life right now? In the old day, we used to call that kind of like induced depression. It's related to something that's going on, maybe a divorce.
Right.
Any big change in life.
Yeah, postpartum.
Yes,
That's
changing career.
Absolutely.
All of these things can bring up anxiety and depression. So, but again, I think major depression is, if you're feeling down, at least get that ruled out, because that's the big one, and that probably does need to be treated with medication.
Typically. Now, of course, there are underlying contributors.
Right.
Where, yes, you're treated with medication, but you may want to consider chronic inflammation. You may want to consider the microbiome. I know we'll spend some time talking about that.
Yeah, because it's fascinating, right? We're going to get into that. Yeah. And you can test some of this stuff. You mentioned inflammation. There's tests for that now.
Right. Yes. And the reason I say getting away from medication, the common medications, of course, SSRIs, that focus on neurotransmitter balance, helping to get more serotonin, that your happy neurotransmitter or brain chemical available. But the research is now kind of moving away from that neurotransmitter imbalance being that driving,
the key thing,
right?
Yeah.
You kind of have to think about other things.
Well, and you know why? And it took years and years and years to figure this out. SSRIs aren't that effective. Right.
Well, you find that people, I think 3 months out, they've either stopped their medication because it's not working for them, or some of them can lead to even more suicidal thoughts.
Yeah. Now, other medications that you might, if you're on and you're feeling a little down, high blood pressure medications, anti-anxiety. I know in the old days, beta blockers were big, and
for stage fright.
Yeah, it was, and for blood pressure, it was a go-to drug for a lot of physicians. But then half the people would come back depressed on beta blockers. Yeah, so they're not invasive. So, anyways, think about meds that you're also taking as well. So there are, and again, I think this is just appreciating how the body works more. In conventional medicine, we try to find that one thing that's causing it. Here's your one drug to treat it, right? And now I've done my job, now go home. Right? But it's not, it's just, every time we talk about this stuff, Dr. Crystal, it's not that simple.
No, I think a multimodal approach should be incorporated with all things related to health. Think about, what are you eating? What foods are you having? Lots of simple sugars and carbs that's causing like highs and lows. Are you sleeping?
Ooh,
that's a big one, Dr. Mike.
Big one. Yeah.
Not getting a good night's rest. We know that throws off the circadian rhythm, and that's that foundational aspect to health. And of course, balancing the neurotransmitters and
it's a lot.
Looking at environmental toxins.
Yeah. It's not just get more serotonin.
No.
And let's just hammer that in day after day, more day. And again, most things that happen to us are multifactorial. There's multiple things going on that are driving it, and I think natural medicine, integrative physicians appreciate that a little bit more. Yeah, nutritionists for sure, right?
Of course.
Now let's move. Okay, so obviously a fascinating aspect of this is the gut-brain connection. Right?
Yes, that two-way communication between the gut and the brain, also known as the gut-brain axis.
Yeah.
It's thought that, I think it's the vagus nerve, right? That's that communication channel.
Yeah.
From the gut
to the brain. It's from embryology.
Yeah.
The brain and the gut start in the same spot.
Yeah.
And then at some point they go opposite polar regions, and within that stretch of tissue, you get your vagus nerve.
Yeah. So, follow that gut feeling.
There's true. Like people have been saying that for years, right? You get a little nervous. You feel you got the stomach a little gurgly. That's anxiety stuff, right?
Yes. And that two-way street is where the gut can affect the mind, more specifically the microbiome, the population of microorganisms there. It can affect the mind as well as the mind affecting that population or your microbiome.
I could be wrong, but I think most of the research is showing that it is the gut bacteria, right? They're metabolizing food sources. They're producing chemicals, hormonal type chemicals, neurotransmitter type chemicals that can affect the brain. And for someone with a healthy gut microbiome, it can be very positive. But if you're imbalanced there, and from the processed foods and all that kind of maybe antibiotic or whatever, and you're not replacing that, it can have a negative effect.
Yes, we do know that the gut bacteria can activate brain pathways, nervous system signaling. So yes, there is a direct effect with bacteria in particular, and having the right balance of those bacteria, the species there. Critical.
And then we also know mental illness itself, depression, anxiety, can actually affect the gut by, mostly maybe through the immune system.
Right.
Where, mental illness can activate the immune system. That can have a negative effect on the gut.
Right. Well, the mental stress activate the immune system, but you think about what that stress response, and you think about how you feel when you're stressed. When you're stressed, you probably aren't sleeping as well. When you're stressed, you probably aren't eating as well. Now that's compounding the issue. Not
sleeping and going after the processed foods.
Right. You don't have the energy to exercise. Right. And we know the positive benefits of physical activity.
Just like we said, it's all these things.
It's a spectrum.
It's all these things affecting how you feel. Now, okay, but if we're going to talk about a gut brain connection, and I know people like to debate what came first, is the gut affecting that. Let's get into how we can help.
Yes.
And that wouldn't it be simple just to start with some good probiotics?
I think that's the easiest thing to do. Well, first, start with eating probiotic foods, getting some fiber in.
Food first.
Polyphenol-rich foods.
Food first.
Antioxidants, the colorful berries, blueberries, raspberries, blackberries, strawberries.
It's all good stuff. Yeah.
Yum. But those probiotic-rich fermented foods, like your sauerkraut, your kimchi,
love kimchi.
Your kombucha, your yogurt.
I just had some spicy kimchi.
Ooh, that's the best. If it's not spicy,
I know there's a regular one, and then there's a spicy. I'm like, it should be spicy, right?
Yes. Very spicy.
Oh, that's good stuff. Yeah. Hannah agrees over there. She's
yes, that actually eating probiotic-rich fermented foods has been correlated with lower risk of major depression in one study. So we know there's that connection with probiotics, and the studies continue to add up, linking the connection. But more now, Dr. Mike, more than just an association, because association doesn't mean that there's a direct cause effect. But we have the association studies, and we have some clinical trials where there is direct intervention with probiotics in individuals with general depression, like other depressive disorders or feelings of depression, as well as people with major depression.
Right. Now, when you talk about clinical trials and we're talking about probiotics, it's specific strains, right? There are specific probiotic strains, and that's something that I know we want to stress more to our audience, right? That you can look at a specific strain of a good bacteria, and that specific strain can do specific things.
Right.
In your body, right? There's like as an example, lactobacillus, right? That's a known. I think most people have heard that before, right?
Yeah.
But I
think so.
Lactobacillus is like let's just say a family name, and there's tons of species and specific strains under that. Some of them are great for depression. Others maybe not so.
Yeah.
So it's really the movement in probiotic therapy is at the strain level. That's pretty cool, right?
Yes, I think it's fantastic to see that we have gotten to a point with nutrition and research to be specific in that way. And it doesn't take away from, generally eating the fermented foods. But when you're looking for the cause effect that I talked about, that's where you need to identify the specific strain that's been shown to be helpful. A couple in particular, Lactobacillus helveticus roselle 5.2, right?
Yes.
That's
specific.
Very specific. Or Bifidobacterium longum roselle 175.
Yeah, very specific.
When you look at those exact strains, then you're finding that, in one particular clinical trial, combining those two, there was improvement in psychological distress, including depression, among healthy participants, given that for that combination for 30 days.
Yeah. And then wasn't this same, I have here, this same combination was tested in patients with major depressive. This is important, right? You're talking about people who went to their doctor, went through several little tests. They meet all the criteria for major depression,
right.
Something that the pharmaceutical world has not done a good job. We just talked about all this, right? And here you have bacteria, specific strains, significantly improving depressive symptoms in just 8 weeks.
Right. Now, one thing I would have to say, and this is what the research is indicating, that these probiotics, when you introduce them in this way, you kind of have to keep them in.
Yeah.
Yes, you kind of have to. So, yes, this was an 8-week study, but it's something that you potentially will have to take on a regular basis.
Yeah. Well, because as we know, the gut environment changes.
Yes.
Right. And so this is something that you probably want to, and a lot of people think, when they take probiotics in general, or in these cases, these specific strains, that I take it because I'm building up the levels of those strains and stuff. That's maybe not as true as we once thought. What you're doing by taking it every day is you're allowing these specific strains to metabolize the way you want, and that's what's helping your brain. It may not be that you're building up this army of these lactobacilli, right? It's the daily use that allows for daily positive metabolism.
Yes, absolutely.
Selenium with probiotics. Have you heard about this?
Yeah, that was in a study. It included patients with diabetes and heart disease. Supplementation with selenium plus a probiotic formula resulted in improved depression and anxiety scores and metabolic profiles compared to a placebo. So you do see that not just the strains that we talked about earlier, but you are seeing some other strains potentially being beneficial for brain health.
Yeah. So, and there's other strains there. And I don't think we have time to really go into every single one of these, but at the end of the day, what we've recognized, mental illness, and we're specifically talking about depression, there's lots of reasons for it. It's not just, I need more of the happy neurotransmitter, right?
Right.
I need more serotonin, and we're just going to hammer that in day after day with a pill. That really has low efficacy and high side effects, right? And we're just recognizing that there are other things going on. You mentioned inflammation, for instance. The immune response can play a role. And in this case, we're looking at the gut microbiome. And where you have specific strains helping your gut metabolize in a positive way that has a positive effect on mood. That's awesome stuff.
Yeah.
Right? I mean,
I think so.
And you're talking about probiotics, right? I mean, it's good for you. I mean, it's like no side effects.
Well, the side effect is that you may have better bowel movements.
Yeah. And that'll make you feel better.
Yes.
Yeah. So a lot of good information here. I know we have a article, right? Life extension, or is this one of our protocols?
That's a protocol.
Lifeextension.com/depression. Go check out that protocol, because we just barely touched on some of this stuff, right? That protocol goes through so much more information. lifeextension.com/depression. Dr. Crystal, thanks for joining me.
Thank you.
I want to thank everybody for listening. Don't forget, you go to liveforeverish.com. Lots of podcasts to download there. And of course, what do we say? Like, share, comment, and subscribe so you never miss a show. Matter of fact, I call it my 1-2 punch. liveforeverish.com. The 1-2 punch. Give your email so you join the family of Live Foreverish, and then right there you can pick your favorite place that you like to download podcasts and subscribe. All right. Again, that's liveforeverish.com. I'm Dr. Mike. Thanks for listening.